chairs are really like long and like loungy. Well, the three of us are all speaking, each of us, one by one. I don't have the slides. I'm like the easiest of the three.
What's the order?
Karen, then you, then me.
That's what I assume.
I'm last.
That's what I assumed. I just want to assume
It actually works perfectly.
we're all assuming the same thing.
Yeah. Yeah, considering she's the one who's started.
I don't see her in the room. Have you been at the podium? You're saying the mic is best.
I don't think that anybody's just kind of stood up there speaking. It doesn't look like they had to adjust for anything, so fairly straightforward, I think. Then you also have a mic at the side here. So I probably will just sit in my seat, but I don't know.
You're not going to go to the podium? I think I will because of the PowerPoint thing.
Yeah, because I don't have PowerPoint.
Find her? There she is. Always. I think you do well to turn the business into another tower. You have to point out some of the important reasons. The reason is seniors housing is a big issue. The whole history.
All right, good afternoon, everybody. Welcome back. We're about to get started with our plenary session and panel, which is called Housing for Health. So I'd like to invite you to all kind of settle in as we'll be beginning this panel right now. So I'm going to give a quick overview of a really cool project that's kind of been happening with the University of Alberta. And then these three lovely people are going to introduce themselves. So the University of Alberta has recently launched a project that's called Housing for Health. This project brings together private sector partners from over 20 organizations, and this project seeks to improve the design of housing developments to better support the health and well-being of our community's aging populations. What does this mean exactly? Well, it means that development promotes active living, access to healthy food, social connection, and aging in place. It means that reading my same sentence twice. Today's panelists will discuss the role of local and regional planning in addressing today's health and well-being issues. Two pilot projects will be discussed. So one of them is an infill development in a mature neighborhood in Edmonton, and another one is a greenfield development in the town of Whitecourt. So delegates are encouraged to share their questions and join in the discussion. So I'll be running around with a microphone. If you do have a question, put your hand up. But first, we're going to hear a little bit more about these projects and the work that these people do. Thank you so much.
I can't see my slides, so I think what I should do is get my notes. Sorry, 1 second. Sometimes there's screens and sometimes that's okay. Okay. First slide, please. Thank you. Thank you for the invitation here today. We're going to... Is this better? Okay. Great. I was going to say thank you for the invitation here today. I think some of the folks who might be here from Whitecourt or Edmonton might have seen some of these slides. But for other folks, hopefully, you'll find some of it interesting and compelling. I'm very excited that we've got this new project called Housing for Health. It's run out of the University of Alberta, where I'm an associate professor there. I've been away from Canada. I grew up in the Edmonton region, but I've been away from Canada for about a decade and a half, and I just came back to take this U of A position last year in 2018. And one of the major reasons that I came back was also that I have aging parents, right? And so this whole issue of aging in place is also really near and dear to my own heart. So we're going to talk about healthier housing and communities, priorities and opportunities. And what I'm going to do is I'm going to start by talking a little bit about what are, the health issues of priority today, as someone who is trained as a physician, but who works in public health and prevention issues. Then Greg.
Do you want me to run your slides?
No, it's fine. Thank you, though. Then Greg is going to tell us a little bit about how he's been involved in, as a developer in health and well-being issues, including partnering with us in the 2 pilot developments in Housing for Health. And Eleanor is also a close partner to Housing for Health, as head of infrastructure for City of Beaumont, as president of CIP. So she's going to share the planning perspective as it relates to health and well-being. Okay, so I'm going to start by talking a little bit about public health priorities. Right? In the 19th and earliest 20th centuries, our priorities were different in terms of health and well-being as they are today. So in the past, we had things like cholera, tuberculosis, that were really affected by infectious diseases, that were really affected by issues like sanitation, overcrowding. And what did we do with that, right? One of the major things that we did was we partnered together with planning and actually looked at our municipal infrastructures and said, what could we do as municipalities in order to improve the conditions that could get rid of these things? And so we partnered together and developed sanitation systems, clean water systems. We addressed overcrowding. We used zoning to address things like setbacks that would allow light and air to enter our streets. And by doing that, we functionally were able to bring all of these diseases and these epidemics in the 19th century and early 20th centuries under control. And once we did these things in our municipalities, these diseases didn't come back. So today, we've got a different set of diseases. We've got chronic diseases, so heart disease and strokes, diabetes, cancers are now really the leading causes of death and disability. We have aging populations in most of our communities. We've got mental health issues are also really important. Climate change and environmental pollution are major priorities for most of our municipalities. And of course, we still have, issues that we can improve upon for emerging infectious diseases. We still have preventable injuries that we can consider. But we've done a lot in the areas of often safety and in the areas of infectious disease. So today's leading causes of death, I'm going to show you some global data. As I said, heart disease and strokes, cancers, diabetes, chronic lung diseases. So they're now the #1 causes of death globally, about 38 million deaths per year, or over 60% of deaths. And that's even true in the developing world, right? So we know that's true, for example, in the North American context, but that's actually become true even in the developing world as we start to develop sanitation systems and clean water systems around the world. And the leading risk factors are largely preventable, right? Tobacco, physical inactivity, unhealthy diets, harmful use of alcohol, high blood pressure, overweight and obesity, high cholesterol, cancer-associated infections. The reason I have some of those in red is because, for example, in many of our communities, we've done a lot on tobacco over the last decade to two, right? Many of our communities now have smoke-free bylaws that prevent exposure to tobacco smoke. We've got taxes related to tobacco products. We've got quit lines if people are trying to quit. But in inactivity, unhealthy diets that are also linked to high blood pressure, overweight and obesity, high cholesterol, we still have a long ways to go. We're starting, but there's very much left to do. And that, we're impacted right here in Alberta. So these are just some slides showing that. In the last 2 decades, diabetes has been rising exponentially and is now a leading cause of all sorts of things, right? Healthcare costs being one, but lots of suffering and disability too. Diabetes is actually a leading cause of blindness in Canadians. It's a leading cause of kidney failure, and people then needing dialysis or transplantation of their kidneys. It's a leading cause of limb amputations because it impacts people's nerves and blood vessels in their extremities. And risk factors like physical inactivity, you could see it's extremely high in the Canadian context. This is a slide from Participation, and you could see that 95% of our kids are not getting the 60 minutes or more of activity that they need daily. Adults, 85% are not getting the 30 minutes or more that they need a day, or 150 minutes a week. So that's 30 minutes, 5 days a week. And the research is showing us now that you don't even have to get all of it all at once. You can accumulate those 150 minutes during the week, and moderate level activity like brisk walking or leisurely cycling counts towards those 150 minutes. Our world's population is aging. I think many of you know that. We're going from about 500 million people now that are over the age of 65, but by 2050, the world will have about 1.5 billion people. So aging populations are tripling across the world, and we're seeing that in our own communities as well. And we know that as people age, these chronic non-infectious diseases can really impact them. A really key piece to reducing the severe disability from these diseases and health conditions is actually whether our environmental characteristics are going to help people to be able to remain mobile and independent despite growing physical limitations in their lives. And so that is included in things like World Health Organization reports that have come out on healthy aging and recommendations. Importance of mental health issues now around the world, about 350 million people are affected by depression. That's about 1 in 20 people worldwide. It's a leading cause of disability. And if you look at things like effective approaches that are recommended by organizations like World Health Organization, they talk about strengthening protective factors, reducing risk factors. So for example, there's more and more evidence now that when people are physically active regularly, that actually can be protective against depression and anxiety. There are even some trials now that show that if you have mild to moderate depression, physical activity and exercise programs can be as effective as antidepressants without all of the side effects and with all of the additional physical health benefits. I also wanted to show the slide about social belonging, social isolation, lack of social support, because I think often we think, the physical conditions in our communities must affect our physical health or safety, and social conditions must affect things like mental health. And indeed they do, but as I've just outlined, right, lack of physical activity can be a risk factor for things like depression and anxiety, but being socially isolated can also be a risk factor for example, getting your first heart attack. So there are studies that are showing us, like this one here, that if you're socially isolated, your risk of getting that first heart attack can be increased by 50%. And then you'll probably do more poorly once you actually get ill from some of these chronic conditions. So what can we do about that? So there's now been a lot of research, right, over the last decade to two around how environmental conditions in our communities impact either these conditions or their risk factors. So community design, really important, and really important part of what you guys can shape. So these are things that the healthcare system can't shape. We can only do stuff after people get sick. But if we partner together with planners, with developers, we're able to hopefully change the community environments in which people live, go to work, go to school, play, and spend your leisure time. And by doing that, we can actually create the conditions that make us healthier and address the current epidemics, just like we did for the previous epidemics of infectious diseases. So the design elements that tend to improve health and well-being factors are sufficient residential density to allow for mixed land use, because of course that's what creates walkable conditions. But then of course, if you've got that mixed land use, you still have to connect them by well-connected streets and sidewalks. Aesthetic appeal and safety, both from a traffic perspective as well as a crime perspective, are also really important. And when we shape these types of parameters using zoning, using building codes, builders' practices, and government policies, the research shows us we can actually increase physical activity in communities by over 160%. Also, studies show that when you have communities designed like that, there is decreased crime and decreased stress. There is increased sense of community and decreased social isolation. So by moving upstream, outside of the healthcare system, we can actually address multiple social and health issues all at once. Second is street design to complement that community design. So, in addition to the mixed use, in addition to the connected sidewalks and streets, safety issues, as I mentioned, are really important. So landscaping on the streets, improved street lighting is really important. Traffic calming approaches. Can you cross the street safely? I talked about aesthetic elements as well, like landscaping. And landscaping, it's actually really important, that mix and balance of not having so much shrubbery that it feels unsafe and there are no eyes on you, but having enough that it's aesthetically pleasing and you're exposed to greenery. So impacts, another 35% improvement in physical activity levels also contributes to increasing the sense of community and decreasing social isolation and reducing crime and stress. Building design as well can be important elements. And what we do in zoning can also shape building design. It can shape, for example, the frontages of buildings, right? It can shape, which is the interface with the pedestrian. Setbacks can shape whether a community environment feels pedestrianized and for the pedestrian or really primarily for the vehicle. There are ways to shape spaces within buildings through zoning allowances and zoning requirements. So bicycle parking, for example, or even issues like visibility, width of stairs, that can promote stair use. So you might be wondering, what can these little bits of things do? Well, physical activity experts who have actually studied some of these parameters or calculated caloric burn actually suggest that, if people were to bicycle to and from work every day, just 15 minutes each way, they would burn the equivalent of 10 pounds of weight every year. And that's enough for weight loss in the bulk of the population. If the average person was to climb just 2 minutes of stairs per day, they would actually burn enough calories to prevent the average annual weight gains that we see in adults. And these calculations were done in the United States, but likely pertain to the Canadian population as well. And then there was this other study of Harvard alumni men, 10,000 of them followed over a 13-year period, and they found that the men who climbed on average 20 to 34 floors of stairs per week, if you divide that by 7, that's only 3 to 5 floors a day, they had a 29% reduction in their risk of stroke, regardless of whether they exercised in their leisure time. Right? So these things that we do every day in daily life actually are really important in whether we can actually achieve the health goals that we're trying to make. And we know people are trying to achieve the health goals, right? So we've done all this health education, and every year at New Year's, people are making these resolutions, and they're failing. And they're failing because studies are showing us that when we don't have supportive environments, people can't sustain those behaviors that we know they're trying to make. So some of the things that you can do that are in buildings to promote things like stair use include simple signage at points of decision, like at stairwells, outside of stairwells, at elevator call buttons, encouraging people and reminding people to take the stairs for health or other benefits like environmental benefits have been shown to increase the use of stairs by 50% across many, many studies now. Very high-rise buildings, okay, people may not be willing to walk or be able to walk 30 floors, right? But there are now buildings, for example, in California and New York and other places, that actually program all their elevators except for one to be skip-stop. And so they would stop at every third or fourth floor, and able-bodied people would basically end up walking a few flights every day. Because it only stops at every fourth floor, for example. But there's always one ADA elevator that people with disabilities and who need that elevator can use. Design and aesthetic interventions. So, you know, if you put music, art into the stairwells, make it more pleasant. I mean, do all our stairwells always have to be painted gray or not painted at all? You know, bright colors, for example. Visibility when you enter a building, if you can see the stair, but the elevator is fully accessible, but just tucked behind a little turn. There are studies that have been done by, for example, architecture professors who've shown that those types of buildings actually, for people who can use the stairs, it increases the use of the stairs. Natural lighting in stairwells and stair visibility is really important. Social support mechanisms as well within our communities. So having things like walking groups, buddy activities, can increase physical activity as well as strengthen social networks. Food environments are also really important. More and more studies now showing us that if you're surrounded by healthier food, so you can go to the supermarket, to a farmer's market, to community gardens, people tend to eat more healthily, their weights tend to be lower. If you're surrounded by unhealthy food environments, so lots of fast food, lots of convenience stores, those types of environments tend to promote weight gain and are associated with unhealthy diets in both adults and children. Gardens, exposure to gardening tends to increase people's consumption of fruits and vegetables, both adults and children. And then also tap water. You know, how accessible is tap drinking water in our public realms, in our parks, in our playgrounds, even on our streets, particularly as more and more of us are trying to encourage walking, bicycling. Are you able to stop and garner this free and environmentally friendly beverage, or do you have to stop at a convenience store and buy bottled and canned beverages, many of which are highly caloric? And when we do this, I've already mentioned some of the social benefits like crime and social isolation that can be decreased by creating more walkable, activity-friendly communities. But there are additional co-benefits. So in this document called Designed to Move Active Cities, a guide for city leaders, basically a literature review was done of all the various benefits that healthier communities can have besides health. So we've already talked about some of the safety benefits, but economic benefits as well. So there are now studies showing us that, you know, more walkable communities may actually increase retail sales and retail volumes, decrease retail vacancies. It has potential benefits like, for example, there are studies that show us that if you were to create more compact communities with complete streets, that kind of infrastructure investment tends to actually create more jobs for every dollar that you spend on development than a sprawled infrastructure with streets for cars only. The reason for that is you're saving a lot usually on physical infrastructure costs like land, all of the physical infrastructure that has to go into a sprawling area. But your compact community that has complete streets, the complete streets infrastructure actually requires more labor costs to create. And so if you wanted to create more jobs by spending on development, you could probably do that, create more jobs for every dollar that you spend on development if you're creating more compact communities that have complete streets as opposed to the latter. Anyways, I was working for Mayor Bloomberg's administration for basically about a decade in the United States before I came back to Canada. And I just wanted to show some examples of what the partnership between, so I was working for the health department, but my job as the inaugural Healthy Built Environment Director was to work with basically our planning departments, our housing departments, private sector developers, transportation, school construction, to see what we could do about addressing New York City neighborhoods and physical infrastructures in order to make them healthier and synergize also with other development goals such as environmental friendliness, economic development, et cetera. And so some of the things that we did, we worked across different types of settings, but I'm just going to highlight a couple of things in the community setting. So one of the key things was, Plan YC 2030 was New York City's master plan. And one of the things that we were able to do was when we updated those plans, we actually integrated health and well-being goals and objectives directly into those plans. Philadelphia, in their 2035 plan, has also done that. So there's been a number of jurisdictions down in the US that's done that. So they integrated in active living, healthy food access and beverage access goals right into those master plans. There are now, we ended up in New York, because of some of our successes there, which I'll show you, the US Centers for Disease Control actually ended up giving us a grant that created a peer-to-peer mentoring network of municipalities and counties across the United States. And we ended up with 15 jurisdictions that we were working with. And so various types of things that you saw were reviewing. Whenever a new development was being reviewed, there would be the health lens would be integrated for things like active living, healthy food and beverage access, decreasing unhealthy food and beverage exposure, and then can you be using those communities to increase social interactions and decrease social isolation. Buildings, whenever they were being built, particularly if it was public sector buildings or buildings in which the city might be investing a significant amount of money. Then certain guidelines that we co-created together across departments in New York would be utilized. So we created a series of guidelines called the Active Design Guidelines and Supplements. And I've tried to put all these resources together on my website. They're available for downloads and for free. Folks in the development industry and in the architectural worlds also asked us to create green building rating systems. So for LEED, for example, there's now a credit called Design for Active Occupants that was created as part of this work. So, if you integrate in some of these elements into the buildings, you can actually get additional credits for LEED certification. I was involved in LEED for neighborhood development, and there was a whole kind of health overlay that was done with that as well around healthy food and active living. There are now urban agriculture innovation credits as well that can be utilized. We used them in some of our buildings that we worked on. There's now also a new certification system called WELL, W-E-L-L, and it has both a building as well as a community standard for certification. And WELL actually it's the equivalent of LEED, but for healthier buildings and neighborhoods. So there are now these new additional health-focused certification systems that can be utilized. Global Streets Design Guide is, a guide that's been created by NACTO, National Association of County Transportation Officials in the United States. And, it's being utilized in various places around the world. And then administrative policies themselves were utilized during the Bloomberg years. So for example, a mayoral order was actually executed in which all new city construction actually needed to review itself against things like the active design guidelines and the supplements. Affordable housing, for example, all new affordable housing had to integrate in enterprise green communities criteria, and new RFPs that were generated also referenced the active design guidelines that developers who were putting in proposals needed to basically identify which strategies they were able to do within their new developments. And then, you know, one of the other foci was, in addition to general community environments, was environments that would impact our most vulnerable populations. And so those included aging populations as well as high needs populations like those who might need affordable housing. You know, we also created new tax and zoning incentives by working with supermarket operators to see what their needs were in order to develop or expand new supermarkets in our high needs neighborhoods. That basically were food deserts, right? So they lacked supermarkets and healthy food. And economic development was right in there with us because basically those were the neighborhoods often that also lacked jobs. And so through an initiative called Fresh Food Retail Expansion to Support Health, which is a series of tax and zoning incentives for supermarkets, we've now actually since the start of that in 2008 been, you know, able to create and develop over 20 new supermarkets that's not only provided healthy food options in these food desert neighborhoods, but actually has created thousands of jobs as well. And then just some examples of successes. You know, New York City, along with, you know, I mentioned Philadelphia and San Diego, who were part of our mentoring network of counties and cities that took this very broad environmental approach to addressing obesity and our current chronic disease epidemics. We were able to actually reverse childhood obesity trends while most other places are just continuing to see childhood obesity skyrocket up. So we're now in a sort of a downward trend trajectory for childhood obesity. You know, we were able to increase bicycle travel and transit ridership into the central business districts, despite already high transit use in some of our areas. And at the same time, decrease traffic fatalities, both for pedestrians, but also for drivers, right? Because usually in a collision, drivers and their passengers are also injured. Air pollution levels, of course, also decreased in areas that we pedestrianized. No physical activity whatsoever has declined, and life expectancy has increased by over two years, just in approximately 1 decade of work. And additionally, we also measured economic outcomes and were able to show that, you know, in areas that were pedestrianized or where bicycle lanes were put in, we primarily saw retail sales increase and retail vacancies decrease. So if you're interested in some of the resources, as I said, I've summarized all of this into the resources page on my website, and there's many things there that are free. It's already created. Please use them. A publisher also approached me a few years ago to say, hey, do you want to capture some of the lessons learned and some of the stories of the work in New York and elsewhere? And so they are going to publish this book called Fit Cities, and it's going to be coming out in January, on January 7th. So if folks are interested, that can, there's some, you know, process lessons and stories behind some of this work. So in Alberta, we currently have this project called Housing for Health. And what it is the federal government, the health arm, Public Health Agency of Canada, it actually approached me several years ago to say, hey, given the success around life expectancies, around the reversing childhood obesity, can't we do some of this in Canada? And so I had sent out basically an email to the folks that I knew across Canada, And I got the fastest, I think, response I got back was from Greg and some of the Alberta folks. And so we started writing together this grant proposal, and I'm happy to report it's been approved. It's a 5-year grant, so we got approval for it just at the end of 2018. And we're going to be working together across different sectors to improve health for aging populations. We've got, a partnership working group currently. If folks here are interested in joining, we'd love to have you. The partnership working group isn't too onerous. We only meet like 2 or 3 times a year to network and to get updates and to share some lessons learned. We have 2 pilots that are currently occurring that Greg has donated. One it's an infill in Edmonton, and one is a greenfield development in Whitecourt. And we're also working closely with City of Edmonton folks in different departments, from citizen services to planning to urban design to mayor's offices. Similarly, in Whitecourt, they have their rec department, their planning department, their economic development department, as well as the mayor's office. Because of course, our housing developments are only as good as how they also connect into our communities and community amenities. And then basically for the folks who move into these developments, we're going to be measuring the health and well-being outcomes. And we're also going to learn process things, right? Like, what are things that are really expensive and difficult to do, or what are things that are actually really inexpensive and easy to do that could potentially improve health and well-being, right? And if there are things that are inexpensive and easy to do, we'd love to see that be scaled up, across all new housing developments, either for aging populations, affordable housing, even market rate housing. We'd love for our developers to learn and also take this on. Particularly if it's, inexpensive and not difficult. For expensive and difficult, then I think, a conversation with our ministries and with you guys are also really important to speak about how can we, are there incentives that we can consider to try to bring some of these items that might be important to scale. And on our working group, we've got folks like geriatricians, primary care docs, et cetera, community residents through our community leagues and community boards that are giving inputs into the developments. And then community engagement is also a really important piece. And so, those are community engagement. We're going to be undertaking community engagement workshops with community residents in both Edmonton and in Whitecourt. And finally, sharing lessons learned broadly. So each year, there are plans in the next 4 years going forward for an annual Alberta conference that will share lessons with other Alberta communities. And if other Alberta communities also have really interesting case studies around healthier housing and healthier community developments, we would love to also showcase you guys and have this joint conversation. So with that, I'm going to turn it over to Greg, and then Eleanor will speak after that.
Thanks, Karen. Just wait for the slide to come up. As you heard, and some in the room already know me, I'm a builder-developer in the Edmonton area, and we are involved in other communities around northern Alberta. And my background goes back to Canadian Home Builders Association, been involved at 3 levels, locally, provincially, and nationally, and also chambers of commerces. So we're sort of the private sector voice here. The slide there, you'll see 2 logos there. One, Alberta Community Builders, is a group we created to promote aging in place. And we found a relatively small number of private sector builders that were active in aging in place. So we've subsequently updated our websites and our materials around complete communities. So if you are bored one evening, look up Alberta Community Builders. We certainly have, I think, the best political words tied up in our website. And CHBA, actually, we're now called BUILD, but I won't confuse you. First, I'm going to give you a few principles, and I've changed these for this presentation, and then I'm going to give you some case studies. So the first slides are more from the principle side, but we're very much advocates around residential models of care. You've often heard a debate about institutional care. And specifically, things like hospitals are costing more and more to build, and I don't mean to denigrate or demean anybody, because Calgary has the same problems in Edmonton, but the Grand Prairie Hospital is the famous poster child right now. I think it's on its 8th or 9th year, and $763 million, and the size of the project and the number of active beds keeps declining. So you could make an argument that we need acute care hospitals and we need long-term care facilities, but increasingly the marketplace is telling us, I want to live in an attractive community, I want to have choice, I want to have freedom, I want to have restaurants, I want to have bars, I want to have my grandkids around. And the trick is now to integrate care into those housing models, and it can be done very cost effectively, and that's what we've been working on for a while. Part of that, of course, is just the general marketing aspect of promoting healthy, but also you heard Karen talk about social lifestyles. So there is the physical component, but increasingly isolation for seniors is one of the worst. Everybody says, well, my mom is doing great, she's living by herself. Or my dad's doing great, he says, you'll take me out of this house in a pine box. Well, this is not always the best lifestyle, and I know many in the room invest a lot of time in keeping their parents engaged as best as they can, but we would argue, and we're biased, that the village is like, the old saying was, how many people to raise a child? It takes a complete village. I would argue the same applies to seniors. This slide here is a group that we became familiar with more than 10 years ago, and we admire them. They're in Chicago, Illinois, actually Evanston, a part of Chicago. And they've been one of the leading groups in my experience around wellness principles. So look them up. They've done actual studies on what makes well communities, 26 parameters. The main ones to summarize is intent of your community. If your community doesn't want to be well, it won't be. And walk the walk is really one of the second principles that I've learned from this organization. Don't preach it and don't practice it. The third one is, don't segregate, make it more cross-pollinized. And the 26th factor in wellness communities is climate. So as we go into winter in Fort McMurray and Edmonton, don't believe it can't be done in a winter environment. One thing we emphasize is very much supportive workforce, particularly in the health industry. Your biggest cost is salaries. And the demographics, we have an aging population, but we're going from 11 and 12 workers per senior to 4.3. So yes, everybody knows the number of older people is increasing, but the number of worker per older person, so many of you from the smaller communities will realize this, that attracting a service workforce, whether it's the Tim Hortons or whether it's a long-term care or an assisted living facility, we would advocate, and this is our chamber hat, that all communities should have a strategy around affordable housing. And that strategy should be around the entry-level workforce. And we would argue that the right way to integrate it is not build mass, large, low-income projects, but integrate a certain percentage, say up to 20% in each community. That leads into intergenerational community. You'll see in this presentation a little later that we're advocating that we build densified nodes. This is a common term. Edmonton's just rolled out city plan. This is something that I share some enthusiasm for with our planning and our mayor in Edmonton, but other cities are doing it. The notion is we're not all going to live in walkable, high-density communities like Manhattan, but we can build in our old town centers or in the new retail nodes examples of these high-density walkable communities. And they're not only an alternative lifestyle, they actually are cheaper and easier to produce healthcare results, and they're actually much more walkable. I put this slide on here, it's a little bit dated, but it's really we're back into an environment where our provincial government wants partnerships, wants efficiency, so the game's wide open again, whereas for several years there the bias was to institutional care and centralization. So you say, Norwood's a wonderful facility in Edmonton, and I'm sure Calgary has the equivalent, but I don't think people from the outlying areas, from the White Courts, want to drive to downtown Edmonton and wait for the LRT gates to see their father or grandfather. So increasingly, we're back into an era where municipalities, healthcare providers, and hopefully private developers can be brought to the table. This slide, maybe the picture's not appropriate. It was about sustainability, an overused word, but I changed a few words on there. You heard Karen mention connectivity. That's a whole subject that'll come up here later in the discussion, but often our communities aren't well designed for transit, biking, and walking. We'll have a path that goes for 30 or 300 or 1,000 feet, and then it dead ends, and we really haven't been very good as municipalities. We almost need a champion or a guardian of connectivity. Walkability, Karen and me share a common enthusiasm for that. Physical activity is not just good for obesity, it's also good for Alzheimer's and dementia, and virtually every medical problem you can identify has some benefit from active, healthy lifestyles and social lifestyles. And there's a triple bottom line on walkability. It's better for your health, it's better for affordability, because maybe 2 cars can become 1 car in a family environment. We're always going to need cars for a while, I suggest, in Alberta. And the third thing is for the environment, of course. So this is one that we did just to run through earlier urban villages. We took an old train yard in downtown Edmonton owned by CP Rail. Everybody said nobody wants to live in downtown Edmonton. We basically put a linear walkway through the middle. The City of Edmonton cooperated a lot. It showed that really the municipality had a lot to this development going, and it was done under a form of local improvements where any municipal services were done, and we added them to the tax base, and it cost the city nothing. I'll tell you about that another day. But the main element, the architecture, you can like it, dislike it. I was trying to make a fairly traditional style of town. We had in Edmonton and Calgary the suburban sort of neo-traditional communities, and I thought there was a market in Edmonton. It's been very successful. The land, for example, when we started was $4.25 a square foot. Now, land in Edmonton varies from $75 per square foot up to $400 per square foot. I'm not saying that's necessarily a good thing, it just is what it is. But Railtown was also, for those who don't know where it is, 109th Street, north of Jasper Avenue to the west side, very near McEwen. And I think McEwen's a classic example of public infrastructure that really revitalized and helped the downtown. And we've really not succeeded, but for over 15 years I've been trying to animate and build streets through the city to where we can connect multifamily housing and seniors to the McEwen campus. This was too far away, but this is really a map we did at the time that sort of showed roadblocks around the connectivity. There is actually a lot of corridors in most cities, including Whitecourt, that can be utilized and enhanced, but in many cases there's barriers and roadblocks. The McEwen connection with Railtown, for example, was one example where we gave everybody free memberships for 2 years at the McEwen Sports and Wellness Center. Our notion is we always put wellness in our buildings, but we want people to participate in the public facilities. They're more cosmopolitan, they're more social. And that was very successful. One of the things we did to identify that, we sponsored actually the Sport and Wellness Center, and we've done similar in Rocky Mountain House and a few other places where we've actually said, let's put some donation charitable dollars into those things. This is maybe hard to see. I've got some packages to hand out, but Peter Vanna and others are here, and some of the people from smaller centers. Shourd Park, which is a classic bedroom community, lots of single-family houses. We've been fortunate to be involved in 2 urban villages. This one is in their town center. They didn't really have a town center for many years, and it's taken a number of years to put together, but it's based on a linear walkway down the middle, which we call Prairie Walk. I'll back up for a minute. You won't see it, but the blue is a seniors complex called Bedford. The yellow ones to the left are 4 condos, 3 of which are built. They're all connected underground, so in the winter you can go from a condo to the seniors building and you can socialize and you can get medical services. It's also a very subtle way for nurses to commute through the site with sort of very discreetly. And there's a commercial component and a heavy component, as you'll see in the next slides, of public infrastructure. So Bedford's a 5-story brick building. The stone in front is Prairie Walk, but I always say it's epicenter for social. We have courtyard concerts. We have things like that. You'll see on the next slide, which we got here, a little slide of Prairie Walk, but you'll also see Festival Place, the art center. So it's walkable. We can do little concerts in our building, and the same artists, we can buy tickets for our residents or promote concerts, and then people go to social events. So it's not just physical, it's social, and music is a big part of that. These are just more recreational slides that we put in here, just to show that the public infrastructure can be leveraged. But really, walkability is your most cost-effective form of exercise. This is another one that's just underway. This is 50 acres. Railtown was about 14 acres. Center in the Park was about 14 acres. The next tranche will grow. Another circle of development will come into play. This one's in a greenfield situation. You can't tell, but the lower right-hand corner is affordable housing for families. We donated 7 homes to Habitat for Humanity. It's based on a similar principle as Railtown. Cars around the outside, linear parks down the middle, And the scale is large, and this one's slower in gestation. I know when Karen saw it, she didn't think it was particularly walkable because there's a lot of dirt and undeveloped land there. But it's based around, as Railtown was, a grocery store anchor. We find that grocery stores, if you can get them, are a very attractive amenity. We heard about healthy food, but grocery stores also code for pharmacy, post office, doctor's offices. So this thing basically starts with rental housing and family housing on the right-hand side, which is a busy road, and then it moves to parks in the middle with high-rises into the middle, and it starts in the lower left-hand corner with bungalows and active adult condos, and then independent living seniors, then assisted living seniors, then long-term care, and then subsequent to starting this project, there's actually, a pseudo-hospital. And it's a controversy in Shourd Park. It doesn't actually have overnight beds, so it's kind of a community health center. So I'll ram through, but when we originally met Karen, it was at a public health thing in my presentation. I left these slides in because we're in Fort McMurray, and there's probably no better community in Canada for the major recreational facility. So I wanted to bring that to attention. These things need to be leveraged. I don't see a lot of housing right around some of these rec centers like where we are right now. In my world, there'd be high-density housing right around them, and the residents would get the value from these rec centers, but not just traveling by car or bus to them. Similarly, you'll see that walking is a big issue in a lot of modern communities, including Fort McMurray, particularly up in Timberstone, or what's it called, Thickwood, and up in top Parsons Creek. So, and this is just a map of all the walkways. So I am aware of that, and we have been up to Fort McMurray many times for discussions about seniors housing and aging in place. I left this one in because U of A, I said walk, don't talk. You know, U of A actually has done very little to develop mixed-use communities. If you're familiar with UBC, they have a great development called Westbrook Village. Before that, Hampton Village, very successful in integrating high-density housing of different age groups around recreational facilities. Simon Fraser has a development called Universe City, spelled last four letters, C-I-T-Y. Calgary now has a development which formerly was called West District, which is now called University Precinct, which has been very successful. So there is examples in Alberta, but there's a lot of pieces of dirt out there with rec facilities and grocery stores that aren't being developed right now. This particular piece of land, there's no housing. You're not even allowed to park there. There's an LRT station and all these fabulous facilities, and they're not being leveraged. This is just a very old plan that Stantec did around this campus. The political will hasn't been there. The NIMBY has shut it down. This is back to now Housing for Health. The two projects we're working on, as Karen alluded to, one is a mature neighborhood project in a neighborhood called Hazeldean. So the houses were built circa 1956-57. Many neighborhoods in Edmonton have a rapid growth after the Second World War, and that neighborhood is predominantly single-family houses. There's only one multifamily project in the neighborhood. It's a 19-acre site that's all affordable townhouses, 236 townhouses, relatively low density, but it's adjacent to a school, it's adjacent to a community league, it's adjacent to an old strip mall, and we think this represents the best opportunity for densification. It brings together the affordable family housing, and we have a number of students, both at Norquest and McEwen, care workers who live there, and we give our staff a discount, and we've also worked with the government of Edmonton and Alberta to create a Cornerstones program. If you make less than $52,500, you get a 30-year rent back. So anyways, this is an example of a mature neighborhood. I missed the boat on the seniors thing. You won't see real easily, but you'll see on the left lower, there's seniors apartments. Those are the townhouses in the middle. And now we're starting to work on taking these row houses and turn them into little boutique coffee shops. There's the neighborhood north where I live, which is less than a kilometer away. 3 young ladies opened up an ice cream store. On a good day, they sell over 1,000 servings of ice cream at $5.50 a piece. Do the numbers on that. We'll all quit our jobs and open ice cream stores. But the notion of it is people are moving back to mature neighborhoods. The one thing about the baby boomer and older, as their kids grow up, the need always to be out into the acreage and the drive till you qualify is greatly diminished. So I think successful communities will offer this lifestyle. It's not for everybody. I always say if it's a 10,000 person village to support a grocery store, 8,000 will live in single family homes. And I'm all for that because that's Alberta's trump card in terms of attracting family and future generations. But I think we're missing the high density walkable communities with integrated care. In Whitecourt, we have a similar problem now. Alberta is a resource province. Whitecourt is resource-based. huge cycles, stop, go. I've been through 3, 4 of them. I don't know if I can go through any more cycles. I'm 64. But Whitecourt is a great, stable family community, great workforce, great staff, administration, and land to be developed. One of the challenges in smaller areas is that, saying that Peter and Janine certainly knows, is that the servicing cost to bring on new land is more than the market cost of the land. And we've been fairly careful. We just developed in Rocky Mountain House in recent years, and we've developed Red Deer's an urban area. I wouldn't put Red Deer in this league. Lacomb's on Highway 2. But I think as you get into the off the Highway 2 corridor types of sites, there's a reluctance for lenders, financiers. Everything's a little bit more challenging. So I think that the Government of Canada, Public Health, was very wise to include Whitecourt, because Whitecourt's got a huge need for care for seniors. They've been aspiring for a new hospital. Every community in Alberta would like to have a new hospital. I identified the cost requirements of that. I think it's more about integrating healthy living to your residential existing, leveraging your facilities and your parks, and then integrating and backfilling alternative lifestyle choices, which can be bungalows, condo apartments, rental apartments, independent living, and assisted living. So I'll wrap this up real quickly. I mentioned 100, 200, and 400 meter radiuses. Increasingly now we're putting these little red circles on our drawings to give you a sense of scale. So that first red dotted line circle is 100 meters. The second one is 200 meters. In the upper right-hand corner, there's a 400-meter thing. You're often told in transit-oriented development that 400 meters is a 5-minute walk. It's a relevant parameter for sure. When you get into initial developments for us and for my target market, which is the retirees, it's 100 meters. What's within 100 meters matters a lot. You can't get across the street. 200 meters might be my workforce environment. So we're increasingly looking at it. And one thing I should mention before I abandon the microphone here is that I mentioned the winter thing. So Karen and her team is going to really do a lot of good work on evaluating our projects. We think on the building side, a lot of work has been done on universal design in Alberta. The Rick Hansen group out of BC is coming up with a scoring system. I think what's missing is the connectivity, to use that word again, between buildings, and particularly as a winter culture. So whether that's underground, plus 15s, which are costly, we're just opening a building in the Westmount area and we just put all heated sidewalks in. First project we've done that in. We had done the Southwoods project, which I showed the slide, has a geothermal field and a cogen unit, and we can't even use up all the heat we create producing power. So we're going to learn a little bit about how to take resources like the heat we create, how to heat sidewalks, how to put railings in. The site plan, I won't go back to it, but when we started, we picked a low density part of the site. If we could do it over again, we'd put it by the commercial, we'd put it by the care. So I guess what I'm saying is experience is a great teacher. So we're here to work with groups, much like Karen's group and all the people she's bringing to the table. And anybody in the room who has projects or ideas, as Karen says, we go forward on this Housing for Health. We hope that we're a platform to share these ideas. I think that's it. Thank you. Yeah.
Hilarious that I have a cold and I'm about to talk to you about healthy communities. So, how are you doing? I see some of you are kind of nodding off, struggling with just eating lunch. If you need to stand up, stretch your legs, take a walk around. What I wanted to do with this part of the presentation was take us in a different direction where we start to reflect on our own practice. And before I should do that, I should tell you who I am. My name is Eleanor Mohammed. I'm in my second term as the president of the Canadian Institute of Planners. I'm also the Deputy Chief Administrative Officer for the city, the new city of Beaumont. And I'm actually thrilled to be here today and talk about this with you. My other obligation, I should say, for the Canadian Institute of Planners is that they do have a healthy communities policy. I don't have it here with me today. You can go check out the website, and it's a great document. So I want to talk about 3 elements that I think are important to our professional practice when it comes to creating and planning healthy communities. Was there anyone at the CIP Centenary Conference in Ottawa? I know at least 1, 2, 3. Okay, so you might have heard me speak a little bit about this before, where I'm going with this. And the other thing that I should say is I am going to talk about trauma a little bit. So if you have trauma and that is a trigger for you, I'm warning you right now. We're going down that road. Okay. So the first thing that I want to talk about is, and perhaps have you think about in your own practice as well. I'm going to share my stories with you. And the first one being is it by accident that I became president of the Canadian Institute of Planners? And is it purely luck that I became the Deputy Chief Administrative Officer at the City of Beaumont? And I would argue no. I was born in Canada. I was born in a safe place with fresh water. Both my parents were happily married when I was born. I grew up in a good neighborhood. They were wealthy, not overly wealthy, but suburbanite wealthy. They got divorced eventually, but they didn't get divorced because of drugs, alcohol, or violence. They just decided they didn't want to be married anymore. I went to the university of my choice. I graduated. I started my career. I had 2 daughters, and I could afford childcare. I worked on a master's when I was working. And then I steadily climbed my way up through the ladder, I suppose, in planning, to the position I have in Beaumont today, and then also to the position at the Canadian Institute of Planners. I had mentors along the way. I had support along the way. I never, ever in my career faced any barriers based on where I was born, based on my income, social status, race, religion, or sexual orientation. I have lived a life of privilege. There's 2 points in my life where this became very evident to me. The first point was when I got married and I took on the last name Mohammed. And some of you have heard me talk about this before, but apparently there's an Eleanor Mohammed somewhere in this world who's up to no good. It's not me. And she's on the no-fly list. So all of a sudden I became a Mohammed, and I have to tell you, having lived my life till 26, not a Mohammed, and then becoming a Mohammed, was quite a shocking experience when it came to travel. You know those searches that they do on you at the airport and they say it's random? It's not random, and I know that because I'm a Mohammed now. I have to go through extra security. If I don't book with Aeroplan, Aeromiles, or WestJet Rewards, I have to go through an extra step at security every time where they call whatever secret body they're calling to let me on the plane. And I'll share an experience with you from last summer. I flew with my family to PEI, and I'm the only Mohammed who shares a name on the no-fly list in my family, so I was an inconvenience to them. We were flying to PEI, and my father had booked our flight with Aeroplan, so I wasn't using my own Aeroplan, and we were flying with Air Canada. So I got to Air Canada, and as usual, I had the 20-minute delay. They don't tell you why they're holding you there. They don't give you any details. They say a code into the phone. They receive a code back, and then you're allowed to keep moving. And I said to them, I said, I know what's up here. Like, I know what you guys are doing. This is ridiculous. Why can't I keep going? And they said to me, well, you know, it would be a lot easier if you had your passport with you. And I said, you now want me to carry my passport to travel within Canada to get to another province. And this is all because I have the last name Mohammed now. So let that thing, sink in for a minute. So if you were born Eleanor Mohammed, that means from the moment you came into this world, you would be under extra scrutiny every time you traveled. As a Canadian citizen, born Canadian citizen, now you need a passport to travel in your own country. All because of systematic, I would argue, racism. So that was the first kind of experience to me of the privilege that I had lived in my life. And that's nothing compared to what most people, people of color, different sexual orientation go through on a regular basis. The other recognition I've had of my own privilege was December 4th last year when I had a terrible trauma. And I'll talk about that more in a bit. But what that taught me was that those who have suffered trauma, grief, loss in their lives, sorry, it always catches me when I talk about this, how much more effort it takes to go through your day every day. And in the president position, how much it takes this year for me to be in front of you versus last year. So I just want to share that, and I would ask that everyone in this room, I don't care about your background and where you came from, think about the privilege that you have in your life, and when you practice planning and you go out there and engage, that you think about maybe the filter that you're looking at your community through is completely different and privileged to those in your community. Professional practice element 1. So I'm going to keep going, pushing through. This is my goal for today. Okay, so this one's going to be the difficult one for me. The second thing that I want to talk about is culture and mental health in our workplace. I want to talk specifically to managers in this room, directors in this room, anybody who hires planners in this room, anybody who's responsible for planners in this room. And don't forget, you're also responsible for each other, so it's not just about who you're reporting to. When planners first come into the profession, they have an incredible spark. They want to make change and build great communities. Somewhere along the line, unless they're very strong people, it gets beaten out of them. It does. There's something about the president position that people will share all their business with you, more than you ever wanted to know. And you know everyone's dirty laundry, and you hear about what's going on in different communities and how planners are being treated and not supported. It directly impacts their mental health and their ability to be resilient, to go and build and plan healthy communities. I would argue that it's your job as a manager and a director, and anybody who oversees a team of planners, to make sure your planners are in a healthy mental state. Team building, I don't know, cookies on Friday, fruit on Fridays, something healthy on Fridays. You know, going for walks together, all those different types of activities that bring you together. It's your job as a planner and a leader in your organization to help build each other up and not tear each other down. Because don't worry about that. You'll get torn down by the community and council in different places. Your group should be the group that holds each other up. So I want to talk about Beaumont for a little bit, and don't take this as bragging, but it is a special place. We have a really great CAO there, and we've intentionally built our culture to be positive and supportive. Team building, all sorts of activities that are just fun. We intentionally try not to overwork ourselves and work overtime. It's just, if you stay past 4:30 at the end of the day, you get dirty looks, sometimes kicked out of the office. And we practice what we preach. Because you know what? The work is always there the next day. It's not worth being unhealthy and taking on the stress and killing yourselves over. There's the exception every now and then. But this is what we try to work towards. So in the last 4 years at Beaumont, we have really, in the time that I've been there, we've tried really hard to build this positive culture. So December 4th last year, my daughter died of mental illness. Sorry guys, I tried. I say died of mental illness because if you say died of suicide, that sounds like a choice. And mental illness, I believe, is a serious and sinister disease. It doesn't get the recognition like cancer, and it's very difficult to solve. So when this happened in Beaumont, and thank goodness, I mean, we had the session the other day that talked about weavers, and I would argue that Beaumont's full of weavers. So when this happened for me, it was like my family was ground zero, and you could see the concentric circles of grief and trauma all around you. And it was important for me to get immediate help in terms of therapy. But not just important for me, when it happened, Beaumont brought in therapists for everyone in Beaumont if you needed the assistance. Beaumont was there for me like a family would be. There are people in this room that were there like a family for me. And I can see one. She's trying to hide, but she's over there. But anyway, my point is, I'm standing here before you after something really awful and traumatic happened in my life less than a year ago. And I can do that and I can talk about it because I am in a workplace that has a positive culture that cares and allowed me to come back into the workplace as healthy as I could be as I continue to work through this. Now, obviously, my story is very traumatic and very shocking. But the very nature of planning, you're going out into the field, you're testing new things, you're dealing with people like me who have had traumatic experiences and are more than happy to take it out on you as public servants. You have to, in your teams, intentionally build that culture and support each other in terms of mental health. I want you, when you leave today, to think about and be sensitive to the cues of your coworkers when they start to give off signs that there's something wrong. Or they're on social media and all of a sudden they're posting a lot of things about mental health and depression. When people start doing that, they're trying to tell you there's something wrong. They may not even know that that's what they're doing, but that's what they're doing. I had a situation with a planner last week who happens to be a friend on my Facebook, who had moved to a faraway place and had regretted his decisions. And I had noticed on social media that his posts were starting to get very dark. So I reached out to him, and he was in a bad, bad place. He took a risk that didn't work out, at least in his mind, for him. There's another planner I know that also moved across the country as well, who's also very struggling with that decision that they made. Planners, and I think professionals in general, are very hard on themselves. They're way harder on themselves than maybe anybody in their life is on them. We need to make sure that when people are starting to give off cues like that, that we don't just send them thoughts and prayers and memes and all sorts of things like that, that we reach out to them and talk to them and help them. If you are a director or a manager, handing out the employee assistant brochure is not going to cut it. We need to do more than that. Okay, so that's what I have to say about culture and mental health. And I guess out of that conversation as well is thinking about those values that come along with that and bringing that into your community as well. Maybe you have some characters in your community. I know we have them in Beaumont. Some of them are mentally ill. Some of them you think are just annoying you for the fun of it, but some of them are not. And it's to our benefit to learn more about that and see how you can support people in your community, and also how you can design spaces in your community, and also how you can prevent things like social isolation in your community. These all tie in to our collective mental health and how we function in society. The final thing I want to touch on today, and we're running out of time, is technology. We had Doug in here earlier today talking about technology. I was so disappointed he didn't mention Beaumont and our autonomous shuttle. So disappointed. I was just waiting for it. And I said this at CIP as well. Technology is a real blind spot for planners. If you don't know about autonomous technology or simple things that you can bring to your community, like Singapore, where the senior citizens have special cards that they scan across intersections and it gives them more time to cross. Simple things like that. It's coming our way very quickly, all these pieces of technology, and we need to get in front of it. We need to understand the language that private firms are using for technology. There's a major project going on in Toronto with Sidewalk Labs with Google. I'm sure you've heard some things about it. The hot gossip coming out of Ontario last week is when Google goes to have meetings at the City of Toronto about Sidewalk Labs. They don't negotiate anything. So what does that mean to the planners? And what does it mean to the community when you're trying to plan for the public good if you don't know how to speak the language and negotiate with Google and huge corporations like that? And I think planners moving forward, our jobs are safe. I don't know if you've heard me speak about this before, but there is a website called Will Robots Take My Job? I'm serious. You can Google it later. Planners are safe. Accountants are not safe, and lawyers are not safe. And I truly think that planners are safe because there's a reliance on our heart and authenticity and our ability to connect with humans and strategize. And I think as the technology starts to come forward, we need to use it to our benefit to make sure that we're planning healthy communities and we're planning for the most vulnerable and we're planning for the public good. And we can do that the way that we've always done that, which is translators. So translators between the technology and the humans, and building policies that help us move forward. So I think that's partly why our positions as planners are safe. So all of that, I realize that kind of takes you down like a weird and windy road, but all of those elements, I strongly believe, acknowledging your own privilege, building a positive culture, supporting the mental health of your colleagues and your teams at work, and understanding the technology that's coming our way are all important elements to our practice to building the future's healthy communities. Thank you.
What time are we at?
Yeah, we have 10 minutes.
We have 10 minutes, so we're going to open it up to questions and discussion.
Who has our first question
Or comments.
or comment? Oh, perfect. Thanks, Carrie. Hi, my name is Carrie Florazone. I'm the planning manager at the town of Edson. And just thank you for all of the information you shared. We struggle a bit in Edson. The only building that's publicly accessible that is over 2 stories are hotels. So I would love to climb more stairs. When I was an undergrad at the University of Calgary, the geomatics engineering computer lab was on the 4th floor, so I miss stairs. We have a very flat grid community. CN did a fantastic job when they laid it out. So we have a lot of connectivity that way, but we really struggle in the winter, and last winter was my first in Edson, and just the commentary from the public on we don't have anywhere to go in the winter.
Nobody shovels their sidewalks, and we don't have a walking path in our rec complex. We don't have malls. Any suggestions of maybe some strategies or some quick wins or even some like longer range? We do have a multiplex project that council is committed to and is being funded with Yellowhead County as well, which is fantastic, but that's still several years away. So.
I was going to say that, you know, I think you had mentioned that one of the issues is that the sidewalks aren't cleared, right, in the winter time. Is there a way to address that? I mean, that is a maintenance function that, you know, decisions can be made around, and different decisions can be made around. So I would say that's, you know, one thing to start with. And perhaps, you know, there are designated paths that you could start with, right? I was going to say that in terms of creation of spaces for people to gather, I mean, there are different ideas that and innovations that have been done in different communities. So there are communities, for example, that may have warming stations, you know, placed along walking paths where people can stop and gather. Sometimes it actually can be done in partnership with businesses, because if people are stopping and gathering in front of those businesses like coffee shops, it can actually help to boost sales for that particular business. So partnerships, public-private sector sorts of partnerships that could create more of those opportunities as well. So those are some things that have come up. I know that for us, as part of our community engagement work in Housing for Health, we are working in Edmonton. There are, you know, over 150 community leagues, and these are basically, you know, community resident groups that are like residents who are volunteering to try to make improvements to their communities. And so we've been working now with, we've started working with over 20 of them that have signed up in different parts of Edmonton that are interested. And we're working with them to do workshops to identify community resident ideas for what they would want to see around active living, healthy eating, social connections. And we're going to try and culminate that in some actual pilot interventions, so pop-up sorts of interventions that can occur. And we're anticipating that some of them will occur in the summer, and maybe some of them will actually occur in the winter as well. But I think for the winter part, you know, the component regarding what can the municipality do around some of those maintenance issues, even if initially it's perhaps around designated paths to start, are important ones.
Yeah, I'm glad Karen mentioned pop-ups and things, because a lot of it is programming too, so we'll come back to the physical part. But I would argue that in every community you need some ringleaders, some role models, and they need to be supported. And sometimes they need professional assistance. I don't know if that's a hard and fast rule, but sometimes you just need to identify in your community. And Karen spoke to me in past, not about Winter or Edson, but the notion of kids going to school in the virtual school bus, where you say, okay, here's a task, walking school bus. And you say, okay, grandmother or whatever who's a walker needs a little bit of purpose. And sometimes it's just sharing ideas. We try to pop up, Karen and me and other people at McEwen. Didn't go particularly well, but to be honest, we got bad weather and everything else. But we did another one for the launch, and we aren't giving up on that idea that sometimes you just need the notion around a positive principle, and whether it's some music and some hot chocolate and whatever and mini fairs, and then sort of create an ambience. But for the very older people, I know in some of our buildings, it is about the walking club. People will walk the hallways. And although the stair thing is a bit of a, what's the word, interesting issue, because as people get older, they aren't doing a lot of stairs. I agree, it's really good for people to do stairs, and sometimes they might manage one flight, but if you can create within the buildings, in your case, it might be the new, I don't know the building well, but acute care, long-term care facility, places that actually have some lineal footage that somebody can walk indoor. So if you had walking trails around the outside, I'm just dreaming here, but you got walking trails around the outside for the summertime, and it becomes a place where you gather, a coffee shop or whatever, and then it rolls into, in inclement weather, where you still have something where you can maintain that. And sometimes people will just get together to have coffee. I notice a lot of people going to A&W, you know, guys not that much older than me, or maybe they're the same age, maybe they're younger than me, and they go because they get free refills on coffee. So it's interesting what little social catalysts there are to getting people together. And I think don't give up, I guess is the moral of the story. Yes, it's challenging, and I think share best practices, and I think we'll have the similar situation in Whitecourt where we're a little bit removed, but I think there's things we can do, and we'll work with the community. And Karen points out more optimistically that things sometimes we think as Albertans are a long ways away, or like a 3 or a 5 minute walk, you know, really, to be honest, even in smaller communities. So it's not easy, but and particularly in the wintertime. But I think it's a matter of us prioritizing it and coming up with some events.
Yeah, I think this notion too that you can create spaces and new spaces, and it doesn't have to be expensive or permanent infrastructure to start. You know, so when New York started doing its pedestrian plazas, often it would do the initial quick pop-up pedestrian plaza by plant potters, some street furniture, and paint, right? And that would be used initially to test out whether that space is well utilized, what its impacts might be in the nearby retail and for the nearby retail businesses, how community residents are receiving it, before actually laying down permanent infrastructure that can cost a lot of money and then is irreversible. Right, so I don't know who's been to New York recently, but if you've seen some of the Times Square and Herald Square pedestrian plazas, they all started with just paint, plant potters, and some street furniture to demarcate a space that could be a gathering space, you know, in the public realm. And so I think the notion here is that it can be done quickly, it can be done inexpensively to start. Yeah, but you know, if you want to talk further after, that'd be great as well.
I think you're at time. I'm okay.
Okay.
Just to finish. I think we said in the presentation too, I think sometimes you got to have eclectic, interesting areas, and people will drive to those areas. Like I think of Edmonton and White Avenue. Very few people walk to White Avenue, but because of the shops and the history and the character, and every community has some areas that have more social relevance than others, but I think you got to build it up.
I wanted to actually make one quick comment around, Eleanor, what you were saying about our own workplaces and our own spaces. I think, you know, I think about all of the sort of government and large institutional work sites. Like I work at the university. You think about all the healthcare sites, our government sector, whether it's like municipal or provincial or even some of our federal buildings. I mean, I think that there are things that we can do, yeah, that from both a physical realm perspective, even how we site, right? If we're thinking about doing something like a bike share, those are potential hubs that we can connect in our communities where we have large numbers of people, right? Not just clients, but like staff. And, you know, so I think if we can start even with our own physical and social infrastructures, and I'm really interested actually in this whole notion of the social organization of work and the cultural aspects of work, because there's actually a lot of literature, like in the science, around how, for example, how much control you have in your workspace, how much job social support, how you reward people's efforts, whether people, when they have grievances at work, are able to voice that. Those have huge implications, not just for mental health, But for, like there's a study that shows when people have grievances at work, if there's no way to voice them, if they're not well rewarded for their efforts or recognized, it can increase people's heart attack risk by 31 times, right? And so, I think if we can look at our own workplaces, and, for us that work in government or large institutions, I think that there are tremendous opportunities to explore that. The connectivity between these spaces as hubs of active transportation and sustainable transportation, as the cultural aspects in terms of the social organization of work, in terms of health and well-being. So just wanted to make that comment.
Can I close with one? Yeah, Karen just queued me up to something that I meant to say, but I forgot. In terms of those three elements that I spoke about, with this new technology era that's kind of coming in, Beaumont has been really great about being able to innovate. And the only reason why we've been able to do that is because we have a culture of trust and security. In that if you make a mistake, it's okay. We learn from it and we move on. And if you have an idea, we want to hear it. And the amount of change that is required for the technology that's coming, that you need to make in your own organization and out in the community, is going to require exactly that trust and a feeling of security that if you take the leap to this new technology, that we're all going to be okay. So that's something to think about in terms of our practice. Thanks. Do you want this or do you want to go up to that?
No, let's take
there we go.
Thank you, Karen, Greg, and Eleanor. This session really showcased the intersectionality between public health and also the profession of urban or regional planning. Eleanor, thank you so much for sharing your personal story and you're sharing your truth with us today. It really showcases how strong your leadership is within the profession, sharing that story to encourage us to all be better practitioners within the profession. We will be taking a break until our next session, which starts at 3:30. But there's a couple announcements I do want to make. We will be meeting for our gala and also our banquet here at Shell Place. The reception starts at 6 and the banquet starts at 6:30. Do wear comfortable shoes. We will also be having a DJ and some dancing, hopefully. And we will have bus shuttle to and from Shell Place to your hotel.